Autism is basically a neurobehavioral kind of a disorder. What majorly happens is there are three specific areas. One is social interaction, second is communication. These are the two important areas which are hugely affected in autism, and that is coupled with a lot of sensory issues that arise. So it kind of, it's a rainbow that we call. Autism is not one single condition. We call it a rainbow because there are multiple things going in, out, and the degrees of symptoms also vary a lot. So it's a myriad of conditions amalgamated. So there was a synopsis done, and we have kind of categorized into a condition that involves an impairment in social interaction, impairment in communication, along with behavioral issues and sensory issues. This is how broad the spectrum of autism is. Autism can be diagnosed as early as 6 months, or because when the child actually begins to interact more, when we expect the children to actually pay attention to what you are saying, when they pay attention to what you are pointing at, just to listen to your command and follow. Like when I say, hey, look at that tube light, or maybe just see how the fan is rotating. So when the kids follow your instructions, that is the age when the red flags begin to show up. Okay, so if the child is not looking in the direction that you are pointing, if the child is also not pointing in the direction that you are pointing, if the child is not making eye contact with the mother or responding to the smile that the mother is giving to the child, or any other family member is giving to the child, so all these are red flags. So as early as 5 to 6 months, it can be begin to show, and by the age of 2 years, it kind of clearly manifests itself. There are norms, that there are specific screening protocols, because autism, the prevalence has increased over the years. And how has this prevalence increased? Is a lot of awareness about the disease has increased, and a lot of people are more watchful about the red flags now. Okay, so screening protocols are designed by I think over there in the US by the American Association of Pediatricians, and over here in India also IAP, Indian Academy of Pediatricians, has designed specific screening protocols which are mandatory to be done at the age of 6 months, 9 months, and again 24 months and 36 months. So screening protocols are a part of your regular checkup whenever you go there to the pediatrician.